Akshay, if you can start your presentation, please. Thank you.
Right. So thank you, Abnish and Yossi, for this opportunity to present on this topic. So basically, this is in a sense a continuation of the previous session, what was discussed about how different options of freelancing, working at your own center. I'm going to put all of that together. A little bit of my background is that I do only oculoplastic surgery. I do not do, being a specialist, my practice is now in such a way that I do not get patients, or I don't see patients who require cataract refractive surgery or general ophthalmology and refraction. I am attached to now 3 hospitals which are under a corporate chain of hospitals, as well as some amount of freelancing. I have a weekly, once a week attachment to a government medical college. I don't have a standalone solo private practice of my own. So at the end of the day, what decides what you end up doing? There are multiple things. You need to sit back and figure out what is it that you want to do in life, whether it is an academic name in the academic circles, whether it is good monetary returns, whether it is a bit of both, or whether it's only good family time with fixed hours. All of these will decide what type of practice you do, which is also dependent on the specialty that you practice. Other things that you need to look out for is whether you're fixed about going back to your hometown, your willingness to relocate to a different city and start all over again, your spouse, their careers, the age of your children or children, if you don't have any, what needs to happen. And also eventually, if you are shifting from one to the other, like for some time you want to do freelancing, then be a part of a large hospital, and then eventually set up your private practice, you need to figure out how long can you wait before you really start earning, because different phases or different practice patterns, like freelancing versus having your own setup, you earn differently on each of these. So what are your different options? One option is for you to stay back in the hospital which you finished your training, if that is available. The other is to join just as a fresh graduate, you join a hospital or a chain of hospital as an associate. You can start away, take the plunge and start your own practice. You can do freelancing as discussed by Dr. Modi. You could go and become be a part of a government or a trust or an NGO organization, or what is called a charitable hospital, or you become a full-timer in a large institute or a corporate hospital. And I'll just quickly go over the pros and cons of each of these. So when you stay back in your training hospital, you need to first figure out whether is this for a short-term process or a long-term thing. Because when you're thinking of the long-term 10, 15 years, then you're going to be a part of the hospital's growth. And then you add a lot of value to it. If you're going to be there just for getting the name tag of being an ex-faculty at so-and-so, so be it. But at least you should be clear of what you want. Now, while you're at it, try to specialize further in something. If you, like, say, for example, oculoplastic surgery, if you've done fellowship from an hospital and now you're a faculty there, try to make the most of that time. Maybe say, specialize in endoscopic surgery or aesthetic surgery. In a way, this is buying time before you actually figure out what you want to do or what you don't want to do. The advantage is you're in a familiar environment, you finish your training, you're immediately back in the game, and you have some steady source of income. What about joining a hospital or a chain as an associate ophthalmologist? See, the thing with this is that you end up joining an established practice or an established surgeon, and you become a full-time associate. So the onus of building the practice is not on you. You directly have adequate volumes and some amount of freedom. The good part is that you start working without having to put in any investment from your side, and you get paid reasonably well. But it also comes with a flip side, the downside also, which is that you're working for someone else, you're working for another organization. At the end of the day, you will be given targets. You have to conform to certain working hours, and you may be one amongst many. So your identity may be lost. And as a junior associate, there's always a ceiling to earning, how much you can earn. So this can be a stepping stone to moving on ahead. So this is also something that one could explore. How about building your own solo practice? when I say a solo practice, I'm referring to a clinic or a standalone practice of your own, with or without an operating room, where the patient is referred to you and you're their primary ophthalmologist. If you need to, you could have other consultants of different specialty coming in for some time. The biggest advantage is that you have complete freedom to choose. You set out the SOP for every patient, surgical patient, or treatment practice patterns for every patient that comes in. Where you practice, what you do, you are essentially your own boss. As was discussed earlier, by being the boss of what you do, your earnings are significantly high, but also it is the most challenging type. It is investment heavy, and you need everybody on your team to be aligned with what you're doing, on the same page. There are going to be overhead costs, and you have to be prepared for an incubation period. You don't start your practice and start doing 10 cases a day the next day. Also, when you have a solo practice, not in larger cities, but in slightly smaller cities, it may be difficult to have a specialty practice like only retina or only oculoplastics. Visiting conferences or other places means your practice is shut and your income goes for a toss for those periods. And here there is no one that you can refer a case to. You will end up learning from your own mistakes, and you are your own backup. Each upgrade of technology is going to be expensive, so it has its own share of disadvantages as well. So in solo practice, you need to figure out what is the right timing for you to start solo practice after training. And once you go in, it's a long-term decision. You can't think of starting private practice for 5 years and then come back and say, no, I don't want to do it. You've invested so much time and equipment into it. It's not for everybody. It doesn't mean that private practice is the ultimate holy grail and the end of practice, the end of the journey for everyone. Some people are just not cut out for private practice, and you need to figure out whether you're one of them or not. How about freelancing? Freelancing is basically where you offer your services as a specialist to different centers, whether it can be in the same city, it could be different centers in the same city, it could be different parts of the city, or even different parts of the country. You could visit a different city in a different state once a week, once a month, depending on the need for you to go there. This, of course, should be in addition to what you are already doing primarily as your hospital attachment. How does it work? You get to decide along with the center that you're visiting. You could either have a fixed schedule, or which means once a week or once in 10 days, once a month, and pre-decide this date. Or it could be an SOS where they just call you, hey, I got a macula on RD today, can you come in? At the end of the day, don't undersell yourself just because there's not enough work happening. Never end up doing surgeries for costs that are lesser than what the market rate is. It has advantages because practice building there is not your responsibility. You're offering a service for a need that is already there. Because there is a need, volume is going to be good from your first day. It's freelancing, you have that flexibility, and it can be rewarding initially. But disadvantages is that everybody wants flexibility, and you don't want to be freelancing at too many places, spreading yourself too thin. Sometimes as a freelancer, you don't always end up seeing what you're trained for. I, as an oculoplastic surgeon, have sometimes been called in to see patients for squint, and I've had a tough time explaining that oculoplastics and strabismus are different specialties, and this is to ophthalmologists. At the end of the day, you're offering your service to someone at their practice, and it's likely that you're replacing someone else. So you are also replaceable. It is not a practice of your own. So that is a disadvantage that is there. And of course, carrying your equipment and consumables everywhere can take a toll over time. How do you break into the scene? I talk about ABC, which is availability, behavior, and competence. All of these things have been discussed previously, so I won't take too much time on it. Freelancing is good in the short term, but because you go visit more places, meet more people, your visibility improves, but it's not sustainable everywhere, every time in the long run. At the end of the day, like I said in the discussion with Dr. Rolika, good results are the basis for good relationships with ophthalmologists and with patients. How about joining a government hospital or an NGO or what is called a charitable hospital? These are good things where you can be an honorary or be in an academic position in a teaching hospital, especially that allows you to treat a lot of unaffording patients. But this, I strongly suggest, should be in addition to what you're already doing. This should not be your primary center of practice, unless you want to stay in a hospital, or as they say, haath safai karna, where you feel you've not had enough surgical practice and you want to go to a place where you learn from a mentor who's already there. And finally, so you finish your training, you're back. Now what? First thing is take a break. The next thing is to work on visibility. Get a business card printed. You may not have a place that you're already working. Just put your name, your specialty, what you did, where you did, your name, your phone number, and email address. Get some brochures made, build a website. Having an online presence is important. To be on groups of ophthalmologists, on online fora, on Facebook, if not for anything, just for seeing what is happening. You may not want to post every day, but seeing what is happening, because visibility is important. Visibility is important, not just online, but also in person. So when you're back in your city, meet the local ophthalmologists. They're the people who are going to refer patients to you. Meet local specialists of allied. Like if you're a pediatric ophthalmologist, you may want to meet local pediatricians. Seek out help. Always if you've trained from a large institute, when you go back to any large city, there are going to be people who also trained from your same institute. So meet your alumnus. They are usually the most helpful. Once you've done all of this, go and meet the local ophthalmologist again, because persistence is important, and do not be dissuaded by all the things that they'll say. 10 years ago, people were telling me that nobody can be an oculoplastic surgeon alone without doing cataract. But work has been good. So that's not always, if you have a decision, you should stick by it and keep meeting them again and again and again, because like I said, persistence is important. You should go to local meetings. Now, of course, things are coming back on track in terms of physical meetings. Go to your local city meeting, state meeting, volunteer to present something, so that the guys whom you met 3 times earlier will see you present and make a connection that, okay, this guy's actually a retina specialist, he's presenting something, he's talking sense. Even if you're not presenting something, go and attend, because networking is important. And something that they don't teach us in medical college or fellowship is fees. You need to be honest, clear, and transparent about it. Like I said earlier, don't undersell yourself. Affiliations with ophthalmologists, where they call you as a freelancer or as an attachment, these are long-term associations, so they should be built on honesty. The foundation has to be good. If you don't know charges, seek out, meet colleagues and ask them. There's no harm in asking. Be honest. Don't operate when you do not want to. Just because someone wants and they feel that there's an indication to operate in whatever specialty, unless you're convinced, don't do that. Don't compromise on your clinical and ethical foundations. Like I said earlier, your best advertisement is a happy patient, but an unsatisfied patient is your worst nightmare. Ghost surgeons are a reality of our practice. I leave it up to each of y'all to personally decide whether you want to be a part of it or not. I from my side, never have been a ghost surgeon, and I'm not approving of the practice of it. But I realize that a lot of surgeons are able to get by operating for someone else, and if that works for you, so be it. In the beginning of our career, once you start working, you realize that you're working a lot, and burnout is a real thing. So you need to pace yourself. Don't spread yourself too thin, attending every Saturday meeting, every Sunday conference. Give personal time to yourself and some family time. From my side, I have no ophthalmological background. So when I came back 10 years ago, I kept meeting colleagues. I met alumni, and that for me worked the best. These 3 hospitals, when I'm affiliated to, all are, the hospitals are owned and set up by alumnus of people where I trained at. And that's how I got in, and that's where I've been for the past 10 years. I am also attached to a medical college, like I said, which allows an outlet for my academic pursuits. I used to freelance a lot, but nowadays I have only 4 places that I visit once in 2 weeks or so. And my website is something that I've worked on, which I feel every ophthalmologist should do that. There has to be a way. In 10 years down the line, patients are not going to be referred through specialists or other referring doctors. Patients are going to refer themselves to you, and that will happen only online. So to summarize, whenever you figure out what you want to do after your training, think, discuss, and decide with your family members and all stakeholders, because it's not only your decision that's going to matter. Everyone's input should matter as well. At the end of the day, you decide what you do, not others. It's like Dr. Bhavik said, never forget your cataract. So if you feel you want to do cataracts, regardless of being a retina specialist or a skin specialist, you stand by that decision and do it. If you feel that, no, I'm an oculoplastic surgeon, I should not be doing cataract because my referrals will get hurt, you do that. Don't let people's thoughts and ideas influence what you do. Be persistent. Align your long-term and short-term plans such that they work synergistically towards the goal. And at the end of the day, don't forget to have fun. Not enjoying what you do is the worst thing to do. I repeat myself, we are a country of 1.4 billion people. There are enough people with a lot of issues, and most of it, ophthalmology, thankfully, is blessed to have so many aging issues that come with it. So as people grow old, there are going to be enough patients for everybody. The concept of an unsuccessful ophthalmologist doesn't exist in India. So enjoy what you do, and eventually you'll have fun. This is one of my favorite quotes. The best way to predict the future is to create it yourself.
Awesome, Dr.